The children's mental health quest has started.
Here, we will summarize our continued session on how COVID-19 affected the medical practice of child and adolescent psychiatry, the surge of eating disorders in child and adolescent psychiatric treatment.
An investigation on COVID-19 and children's mental health was commenced.
When people stay at home and do less activities outdoors, they move their bodies less, withdraw socially from their usual environment, and have less interactions with peers. The time spent looking at a computer or smartphone screen may increase, sleep patterns may become irregular, and dietary habits may become unfavorable. As a secondary effect of this social isolation, a range of reactive psychiatric symptoms has been seen at all ages, and these were found to be associated with changes in eating and exercise behaviors. In a research study of the general population, increased behaviors of both dieting and binge eating were reported after the COVID-19 pandemic, while decreased exercise was reported. Increased dietary restrictions and anxiety about eating behavior have been reported in patients with anorexia nervosa.
Research examining the effects of social isolation and loneliness after infection control measures on children and adolescents suggests a relationship between social anxiety, social isolation, and loneliness. During the COVID-19 pandemic, children were most affected psychosocially, which can disrupt their normal lifestyles and cause a variety of psychiatric symptoms, including boredom, distress, impatience, and irritation. School is both a place for learning and a place for healthy eating.
Food anxiety is known to be associated with poor educational attainment and the physical and mental health of children.
We cannot overlook the risks of inequalities in the educational support system during school closures.
While schools are closed, IT learning is expected to be used, which requires personal computers and a stable internet environment. The number of children with anorexia nervosa requiring hospitalization reportedly increased by 104% compared to the past 3 years. This is also the same in Japan and, according to our report, the number of outpatient visits by children with eating disorders increased by a factor of 2.2 since the spread of COVID-19.
Data from children who visited the Department of Child and Adolescent Psychiatry, Cagande Hospital, National Center for Global Health and Medicine between January 2016 and May 2021 have been tabulated.
There are several possible reasons for the rapid increase in eating disorders, but there has been no strong evidence to date.
However, anorexia in particular is extremely life-threatening because it causes excessive emaciation, weight loss, and undernutrition.
For this reason, inpatient treatment must be introduced as needed, but only a limited number of hospitals have child and adolescent psychiatric psychiatry wards, and even fewer hospitals can provide physical treatment at the same time. Because many areas still do not have specialized departments like for child and adolescent psychiatry, some may also be treated in a child and adolescent psychiatric ward.
However, hospitalization is often prolonged, and overactivity and other behaviors can make it difficult for the child and adolescent psychiatric ward to handle. The rapid increase in number of patients with eating disorders has led to an increase in requests for admission to child and adolescent psychiatric wards. However, the increase in proportion of children with eating disorders being hospitalized may make it more difficult to hospitalize those who should be hospitalized, such as those with violent tendencies to injure themselves, those who have attempted suicide, or those with obsessive-compulsive symptoms or who have experienced domestic violence.
The viewer learned about COVID-19 and the impact of children's mental health, especially the spike in eating disorders. The viewer has now reached level 5.